Did you know that according to the North American Menopause Society, over 60% of postmenopausal women report that masturbation no longer feels comforting, but instead leaves them with dryness, burning pain, or even light bleeding? The frightening part is most of them were never warned that old habits could now be silently damaging their bodies. My name is Dr. Eliza Hart. I'm a board-certified gynecologist with more than 15 years of experience helping women navigate menopause, hormone changes, and intimate health concerns. In my practice, I've seen hundreds of women over 50 come to me with the same quiet question, "Doctor, is it still safe for me to touch myself?" The truth is, self-pleasure after menopause can still be beneficial. It improves blood circulation, keeps tissue flexible, and even supports emotional well-being. But here's the concern. The same techniques that felt harmless in your 30s or 40s can now cause unexpected problems like irritation, microtears, or infections. If you don't adapt to your body's changes, what once supported your health may begin to silently harm it. That's why in this video, I'll share 7 essential medical truths every woman over 50 must know about masturbation after menopause. These insights will help you protect your health, restore confidence, and embrace intimacy without fear. If this topic speaks to you, type 1 in the comments below. If not, type 0 so I know which subjects matter most to you. And don't forget to subscribe and turn on notifications because your health after 50 deserves clear, compassionate guidance. 1. Hormones and tissue changes after menopause. When we talk about intimacy after menopause, the first truth you must understand is that your body has changed at a biological level. This isn't about losing femininity or desire. It's about recognizing that your hormones no longer provide the same natural protection they once did. Estrogen, which kept your vaginal tissue supple and resilient, declines sharply during and after menopause. This single change influences not just how you feel during self-pleasure, but also how your tissue responds to touch. In medical terms, falling estrogen reduces blood flow to the vaginal walls, slows collagen production, and thins the mucosal lining. Tissue that once stretched comfortably now has less elasticity, less cushioning, and less natural lubrication. The result is that friction, which might have gone unnoticed in your younger years, can now lead to microscopic tears. These tears are often invisible, but they create irritation, inflammation, and a higher risk of recurrent infections. In my clinical practice, I have met many women in their mid-50s and early 60s who arrive with quiet embarrassment, describing that what once felt like comfort now leaves them sore for days. They are often surprised when I explain that this is not their fault. It is the direct consequence of hormonal decline. Without estrogen, glycogen in the vaginal tissue diminishes, which alters the balance of healthy bacteria. This change further weakens the tissue's natural defense system, making it even more vulnerable to discomfort. The good news is that this challenge does not mean the end of intimacy or self-pleasure. What it means is that your approach must evolve. Gentle touch patience and the consistent use of high-quality lubrication can transform the experience from painful to nourishing. For some women, local estrogen therapy prescribed by a physician can also help restore tissue thickness and elasticity, though this must always be discussed with a trusted healthcare provider. Understanding this first truth is empowering because it shifts the focus away from shame and toward informed care. Your body is not broken, it is simply asking for different support than before. By honoring this need, you protect your intimate health and prepare yourself to rediscover pleasure safely. And while hormones and tissue are the foundation, there is another hidden factor that can quietly intensify the risks if ignored. Many women underestimate it, but recognizing it early can make the difference between ongoing discomfort and long-term confidence. 2. Dryness is not just uncomfortable, it's dangerous. One of the most common complaints I hear from women after menopause is dryness. Almost every patient nods when I ask if intimacy feels different, and many describe a faint irritation that builds into a persistent, burning ache. At first glance, it might appear to be nothing more than an inconvenience. However, medically speaking, dryness is much more than discomfort. It can be a direct pathway to tissue injury and infection if ignored. Here is why. After menopause, estrogen levels fall, and with them, the vaginal glands produce far less natural lubrication. What once allowed smooth, effortless movement now produces friction with every touch. Each episode of self-pleasure, if done without adequate preparation, increases the likelihood of tiny abrasions that resemble paper cuts. These micro-injuries, though invisible to the naked eye, can open the door to recurrent yeast or bacterial infections, and for some women, even unexpected spotting that creates unnecessary fear. In clinical settings, I often meet women who arrive distressed, believing their body is betraying them. One woman in her early 60s confessed she had stopped touching herself altogether because the burning sensation that followed made her anxious for days. When I examined her history, it became clear that the underlying issue was not age itself, but unaddressed vaginal dryness. The simple introduction of a gentle, water-based lubricant completely changed her experience, allowing her to reclaim a part of her life she thought was lost. From a physiological perspective, dryness is also tied to changes in pH and the vaginal microbiome. Lower estrogen means less glycogen, which disrupts the balance of protective lactobacilli. This makes the tissue more vulnerable. So when friction occurs without lubrication, irritation is magnified and healing becomes slower. This is why I tell every patient after menopause, lubrication is no longer optional. It is a necessary form of protection, just as glasses are necessary when vision declines. Recognizing dryness as a medical concern rather than a personal failing can be transformative. It validates the experience of so many women who thought they had to endure pain in silence. With the right preparation, intimacy does not need to be abandoned. It simply requires new tools and mindful care. And while dryness is a critical factor, it is not the only hidden risk. The choices women make in search of solutions, particularly the use of certain devices, can sometimes create problems of their own, which we need to address next. 3. The wrong toys can be harmful. As women search for ways to adapt to their changing bodies after menopause, many turn to devices or toys, hoping to recapture the excitement they once felt. It is an understandable choice. Slower arousal dryness and difficulty reaching climax naturally lead women to explore tools that promise intensity. Yet here lies a truth that few expect. The toys that once felt thrilling in your 30s or 40s may now pose significant risks when used after menopause. The reason is simple but important. Postmenopausal tissue is thinner, less elastic, and more prone to injury. Large, rigid devices or high-powered vibrators can overwhelm delicate tissue, causing bruising microtears or lingering soreness. What once heightened sensation can now diminish it, not only by causing physical damage, but also by numbing the very nerves responsible for pleasure. In my years of practice, I have spoken with women who came to me frightened by spotting or unexpected pain after using devices they thought were safe. One woman in her late 50s purchased a firm, oversized toy, believing it would make up for her loss of sensation. Instead, it left her anxious, sore, and convinced something was seriously wrong. After an evaluation, it became clear that her body had simply changed, and the device she had chosen was far too aggressive for her current needs. With proper guidance, she transitioned to smaller, softer, medical-grade materials designed for sensitive tissue, and was relieved to find pleasure without pain. There is also the matter of vibration strength. High-frequency devices, while stimulating, can desensitize nerves over time, especially when combined with dryness. This is why I encourage my patients to think of postmenopausal intimacy not as overpowering the body into responding, but as nurturing sensitivity with patience and care. Gentle tools paired with lubrication and awareness often restore confidence far more effectively than forceful stimulation. Choosing the right device after menopause is less about excitement and more about safety, sensitivity, and respect for the changes in your body. By being selective about size, material, and power, women can protect their tissue and still experience intimacy in a fulfilling way. And while toys are an important consideration, they are not the only hidden factor. The strength of the pelvic floor, often overlooked, plays a critical role in whether self-pleasure remains safe or becomes a source of discomfort. 4. Your pelvic floor is more vulnerable than you think. While much attention is given to hormonal changes and dryness, another part of the body often goes unnoticed: the pelvic floor. These muscles act as a hidden foundation supporting the bladder, uterus, and rectum, and they also play a vital role in sexual function. Before menopause, stronger collagen and muscle tone allowed the pelvic floor to withstand more pressure. But as estrogen declines, this foundation weakens, making it far more sensitive to strain than most women realize. The consequences can be unsettling. Forceful or repetitive stimulation may put undue stress on these weakened muscles, leading to discomfort leakage or a sense of heaviness in the pelvis. Some women even report that what used to bring release now triggers anxiety because of unexpected urine leakage or pelvic pain. From a medical perspective, this is not a sign of failure, but simply a reflection of muscular changes that naturally occur after menopause. I recall evaluating a woman in her early 60s who admitted that she avoided intimacy altogether because she felt humiliated by leakage during self-pleasure. She believed something was terribly wrong with her body. In reality, her pelvic floor had lost tone, and the way she was stimulating herself added strain rather than support. With simple pelvic floor exercises, combined with gentler techniques, she regained not only control but also the confidence to enjoy intimacy again. Strengthening these muscles can make a remarkable difference. Practices like Kegel, exercises, guided physical therapy, and even mindful breathing during intimacy can improve both muscle tone and sensation. The goal is not to push harder, but to create conditions where blood flow and responsiveness are enhanced rather than diminished. What I want every woman to understand is that the pelvic floor is not a limitation. It is an opportunity. By giving it care and attention, you protect your body and improve your intimate experience at the same time. Many women reading this may have quietly faced the same concerns, but you are not alone. In fact, I'd love to hear from you. Have you ever tried pelvic floor exercises, and did you notice any difference? Share your thoughts in the comments because your experience might encourage another woman who is silently struggling. And as we consider the role of muscle strength, there is another challenge that requires equal awareness. It's not about structure or support, but rather how excessive stimulation can gradually silence the very nerves meant to bring you pleasure. 5. Overstimulation can lead to numbness. Many women tell me that after menopause it feels harder to reach orgasm, and they often try to solve the problem by pushing their bodies harder. Longer sessions, firmer pressure, or stronger devices seem like the logical answer. At first, this strategy may appear to work, but here's the hidden risk: overstimulation can gradually desensitize nerves, leaving you with less sensation rather than more. Physiologically, postmenopausal tissue is thinner and nerves are more fragile. When exposed to excessive vibration or constant high-intensity pressure, those nerves can adapt in the wrong way. Instead of heightening pleasure, they become less responsive over time. The brain interprets the stimulation as repetitive noise rather than excitement. As a result, orgasms may feel muted, delayed, or even absent altogether. Repeated overstimulation can also interfere with dopamine signaling, further blunting sexual response and creating a cycle of frustration. Recovery of nerve sensitivity is possible, but it requires patience, consistency, and conscious restraint. In my clinical practice, I have seen this pattern often. One patient in her late 50s confided that she invested in the most powerful device she could find, desperate to restore the intensity she remembered. For a few weeks, it seemed promising, but then her climax became increasingly difficult to reach, and when it happened, it felt strangely empty. She was heartbroken, believing she had permanently lost her ability to feel pleasure. After working together, she replaced forceful routines with slower, mindful touch and adequate lubrication. Within weeks, her sensitivity began to return, and her confidence grew with it. This truth is important because it highlights the need to reframe expectations. After menopause, pleasure is not about overpowering your body, but about reawakening it. Taking time, using gentler methods, and practicing patience often create deeper, more fulfilling sensations than any high-powered device could achieve. It is less about intensity and more about sensitivity. I know many women watching this may have quietly wondered the same thing. Am I using too much pressure? And is it making me feel less? If that thought has ever crossed your mind, I encourage you to share your perspective in the comments. Your openness could reassure someone else who is silently facing the same frustration. As we think about physical stimulation, there is another factor that carries just as much weight but is often overlooked. It isn't about devices or technique at all. It is about the powerful connection between emotional health and physical response. 6. Emotional health matters as much as physical. When we think about intimacy after menopause, most attention goes to hormones, tissue, and muscles. But another factor quietly shapes the entire experience: your emotional health. What you feel in your mind directly influences how your body responds. Guilt, shame, or anxiety can create tension that blocks arousal, while acceptance and confidence can open the door to deeper pleasure. From a medical perspective, stress triggers the release of cortisol, a hormone that constricts blood vessels and reduces vaginal lubrication. Elevated cortisol also increases muscle tension, which can turn gentle stimulation into discomfort. This means that even if you are physically prepared with lubrication and gentleness, emotional barriers can still make self-pleasure painful or disappointing. I remember one patient in her early 60s who admitted she felt ashamed every time she touched herself. Raised in an environment where intimacy was never discussed, she carried the belief that self-pleasure was somehow wrong. For years, she avoided it, and when she finally tried again, her body resisted with dryness and pain. After counseling and education, she began to see intimacy as self-care rather than a source of guilt. The transformation was striking. Her stress levels decreased, her body responded with greater ease, and her confidence grew. Science supports what I see in practice. Studies show that women with higher levels of sexual self-acceptance report fewer problems with dryness pain and difficulty reaching orgasm. Emotional state acts almost like a switch that either enhances or diminishes the body's natural response. This is why I encourage women to reframe self-pleasure not as indulgence, but as a legitimate part of health, similar to exercise or meditation. If you are listening and recognize yourself in these struggles, I encourage you to take a moment to reflect. Has stress, guilt, or negative self-talk ever interfered with how your body responds? Share your experiences or questions in the comments, because your voice could help another woman realize she is not alone in this journey. Being open emotionally is as healing as any physical treatment. Emotional health is not separate from physical health. It is an essential partner. And while addressing emotions can unlock greater sensitivity, there is one more risk that must not be ignored. It comes not from feelings or hormones, but from the signals your body gives when something is wrong. Overlooking those warning signs can be the greatest danger of all. 7. Ignoring warning signs is the biggest risk. Among all the challenges women face after menopause, the most concerning pattern I see is silence. Too often, small signals are dismissed as just part of getting older: light spotting after intimacy, persistent irritation, unusual, discharge, or a dull ache in the pelvis are brushed aside, when in reality these are the body's way of asking for attention. From a medical perspective, ignoring these signs can carry serious consequences. Tiny injuries left untreated can progress into chronic inflammation or recurrent infections. Severe vaginal atrophy, if not addressed, can make even gentle touch painful and reduce quality of life. In rare but important cases, bleeding after menopause may signal precancerous changes or even early endometrial cancer. This is why no symptom should ever be dismissed as unimportant. One patient in her 70s came to me after quietly enduring months of bleeding that followed every attempt at self-pleasure. She was frightened but convinced it was just age. After a thorough evaluation, we discovered advanced atrophy. Not cancer, thankfully, but the condition required treatment she could have received much earlier. She expressed relief but also regret for waiting so long, saying she wished she had spoken up sooner instead of suffering in silence. Your body has a language and it begins with whispers. Discomfort, dryness, or irritation are not trivial. They are early warnings. The key is to respond before those whispers turn into more serious conditions. Consulting a healthcare professional when symptoms arise is not weakness. It is wisdom. It is the single best way to protect both your health and your peace of mind. Regular checkups, pelvic exams, and open conversations with a trusted physician ensure that any concerning signs are identified early when treatment is simplest and most effective. I also want to hear from you. Have you ever experienced a symptom that you later realized should not have been ignored? Share your story in the comments because speaking openly might give another woman the courage to seek help sooner. Ignoring warning signs is the one risk you cannot afford to take. When you listen to your body act on changes and seek proper guidance, you safeguard not only your intimate well-being, but your overall health. With this final truth in mind, let us bring everything together and see how these lessons can empower you to approach intimacy after menopause with safety, confidence, and renewal. We have walked through 7 essential truths about self-pleasure after menopause, and together they reveal one clear message: your body has changed, and so must your approach. Hormonal decline alters tissue, making it thinner and less elastic. Dryness increases friction and injury risk, while inappropriate toys or high-powered devices can cause damage instead of relief. A weaker pelvic floor requires gentler care and strengthening exercises, and overstimulation can gradually numb the very nerves that once brought joy. Just as importantly, emotional health plays a decisive role in how your body responds, and ignoring warning signs is the greatest danger of all. My advice is straightforward. Approach intimacy with patience, gentleness, and respect for your body's new needs. Always use lubrication, consider pelvic floor exercises, and choose devices designed for sensitive tissue rather than intensity. If you notice pain spotting or unusual changes, do not dismiss them. Seek medical guidance promptly. And above all, remember that self-pleasure after menopause is not indulgence. It is self-care. You are nurturing circulation, tissue health, emotional balance, and a vital part of your identity. To every woman listening, I want to leave you with this reassurance: you are not broken and you are not alone. The years after menopause can still hold intimacy, confidence, and fulfillment if you allow yourself the compassion and knowledge to adapt. Thank you for joining me in this conversation. If today's discussion resonated with you, let me know in the comments which truth spoke to you most. Your words may guide another woman who needs encouragement. Please subscribe and turn on notifications so you never miss future guidance designed for women over 50. Your health and dignity matter, and I'm honored to share this journey with you.